Hi, good evening, everyone. Thank you so much for joining our virtual town hall this week. And as always, I hope you and your family is safe and healthy during this time. Today we hit the mark of 100,000 Americans lost to COVID-19, and so we're not over the hump yet. And as so often is described, this is a war, right, against an invisible enemy. And so today I'm very honored to be joined by those that are on the front lines of this war. We've got several nursing professionals on with us today. And we've got Dr. Prasanna Parakal, we've got Dr. Jane Neri, and then we have Ms. Golda Manalili. And these women not only are nursing professionals here in San Antonio and previously, but they also lead several organizations of nursing professionals. So Prasanna leads the San Antonio Indian Nurses Association, and then Golda is the president-elect of the Philippine Nurses Association in San Antonio, and Jane just left that position. So since there was just a turnover, we are going to very honored that we have both of their expertise here today. And again, when we look at the numbers of our healthcare professionals, we are seeing that it is in fact our nurses and those serving in the healthcare industry that are have been most affected by this. I think just last Tuesday, the CDC said that more than 62,000 healthcare professionals have contracted COVID-19 here in the U.S. And just 2 weeks ago, San Antonio Express News reported that 1 in 5 of the COVID-19 patients in Bexar County, right? 1 in 5 of COVID-19 patients in Bexar County work in healthcare. So it's really an honor for us to be able to engage with these women that are literally on the front lines of what we're doing. And look, as we celebrate also Asia Pacific American Heritage Month, we want to recognize their contributions in light of this pandemic. So thank you so much, ladies, for joining us. I know you're extremely busy. I know there's a lot going on, so we're very honored that you took the time to join us.
You're welcome.
Thank you. And when we look also at the contributions of Asian American Pacific Islanders to the healthcare profession in general, it's pretty eye-opening, right? We've got 1.4 million members of the AAPI community, that's Asian American Pacific Islander, that currently serve on the front line. And when you look at that, that's 1 in 12. 1 in 12 healthcare professionals is AAPI. More than 2/3 of those folks are immigrants, which means they were born in a different country and have come to our country and are serving in our healthcare industry. When we look at just the nursing field, right, just the nursing field, 1 in 11 nurses in our country are API, Asian American Pacific Islander. That's 348,000. And of those, 260 were also foreign born. So, we can't talk about healthcare in our country now or moving forward without understanding the contributions of our first and second generation Americans. So thank you again, ladies, for joining us. And for those of you joining us via Zoom or Facebook, please, this is again for you. If you've got questions or comments, please feel free to include that. And we will try to get to as many of those in our 30 minutes as possible. So ladies, I want to, just open it up with how are you doing? Prasanna, you lead the San Antonio Indian Nurses Association, which is 80 strong. And Golda, you lead the Philippine Nurses Association of San Antonio, which is about 150 strong. So tell me how you all are doing on the front lines and how your associations are doing.
Well, it feels a lot better now compared to the previous weeks or months, because as you said earlier, we are fighting with an invisible enemy and invisible war. We didn't have much information before, guidelines, so everybody is scared. And you will feel it on the floor, on the units. The staff are scared. They don't know what's happening. So as soon as information, came out and guidelines from CDC and from all the facilities that we work with, it's a lot better now compared to the previous months. So that's good.
Yeah.
And
Sana?
yes, and I'm doing good in this season. And our nurses from San Antonio Indian Nurse Association, they are also doing good because they are well educated, dedicated, and loyal to the profession. And during this pandemic crisis, it is like meeting other Ebola crisis or other viruses that they had experience in another country, and the same infection control methods and prevention methods they are using it. In the beginning, a little bit of anxious because of the unknown and the invisible enemy, but all are well prepared.
Yeah. Well, good. That's I'm glad to hear that. Jane, did you want to add anything based on your experiences?
I think there still continues to be in for San Antonio, Filipino Nurses Association San Antonio, we've dealt very well with it. Filipino nurses have stepped up to the challenge, and I think serving the community and the patients, and in return, the community giving back to us, for us, providing us with food, really helping us get through this. I think it brought people together to a certain degree. It brought the profession closer, and it really broke down barriers and silos. And brought the profession together, to the nursing profession.
That's wonderful to hear. San Antonio always steps up. Our nickname is Compassionate San Antonio, right? And that's exactly how we like to think of ourselves, and you all, with the work that you do on the front lines and caring for patients, especially in this time of uncertainty. That's what I've always been struck by is, you all show up every single day. You don't know what you're going to encounter. And unfortunately, at times, we've also heard about shortages in the equipment, right, that would keep you as healthy and as safe as possible. So can you talk a little bit about, how you are faring now with the personal protective equipment that you need, and where now?
So for us, I think that it's important to understand that there were shortages in some areas. For example, in some states where there's a surge of COVID. New York, and Los Angeles, for example. But I think that now there's some stability in it. It was very challenging in the beginning because where do you shift the resources? Who needs it more than the other is the question. And how fast can it be produced to supply the need in the United States, for example, and in other countries globally too. So it was very difficult. We needed to change the way we do things in our organizations, and to accommodate and create a cohort or put together patients who are positive with COVID, and be able to take care of them properly, and use extended use, programs or instructions by the manufacturer if needed, until the adequate supplies are available. Limit contact with patients, for example. That was very, very challenging, especially for the nursing profession, where touch is so important, and being in the room and presence with the patient is so important. So that's one of the challenges that we have. Like with PPE supplies, I think there's stability at this point now, and many organizations and many people have helped. Factories have transformed themselves into areas that companies that produce face shields, for example. So I think that now there's some stability in the availability. But when you talk about the shortages, I know it was challenging for the nursing profession and healthcare in its entirety in the nation. But fortunately, San Antonio, we didn't experience as much surge as we did in other cities.
Yeah. And we hope to keep it that way, right? Because like I echo what Jane said. So at first it was a challenge, especially for the staff. the frontliners. They feel like there's a shortage, but technically, we didn't have that much of a problem because there's not much surge, like I said. The facilities are more like controlling the release of these PPEs so that they will be efficient and consistent in the use of those PPEs. So we have to educate the staff about that. There's no shortage. We just have to, control, okay, the release of these PPEs.
Our nurses work in a different healthcare system, and wherever they work, they didn't have any shortage of PPE, mask, gown, gloves, face shield, goggles. They had adequate supplies, but they had the news that in other cities, there is a lack of PPE, and they were brainstorming how we can help the healthcare organization. So we contacted other Indian associations like SAVA International and IASA over here, and they started making the cloth mask for us, and they provided a large bunch of cloth mask, and we were able to give to different hospitals. So those with the indirect cares were able to use this cloth mask, and only those nurses who are taking care of the patient, COVID patient, needed N95 mask. So hospital actually were able to save a lot of their PPE by providing the cloth mask. So our nurses were in the front to collect the mask from the community, and we helped the hospital healthcare system in San Antonio.
Yeah, absolutely. As somebody that's running for a federal office, there was one thing, and it continues to be obviously a resource, which is the Defense Production Act, right? And this is where the government says, we are in a time of crisis. We need to produce, this is the need, and this is what we expect the need to be. So we need to, one, make sure we have enough. And oh, by the way, also make sure that our states and our cities and municipalities are not getting price gouged, right? And so to see, we read all the stories of where nurses and doctors are going on eBay and all these other places and having to buy this material. So I am so thankful, that we didn't see the surge that we did in other places of the country. But I think it's always incumbent on our federal leaders to be proactive, right? Especially in times of uncertainty. So, I think we continue to need to leverage the Defense Production Act to make sure that after when the scientists and the doctors are talking about a potential second wave, right, we've got to be ready. We know what we can potentially expect. And San Antonio will be as compassionate and as proactive as it needs to be. And now we need our federal lawmakers to also lean on these companies to make sure that we're ready and we're not getting price gouged.
Mm-hmm.
I've heard, unfortunately, of, you all are on the front line. You're doing this at great risk to your health and frankly to the health of your families. And I've heard this circumstance where our nursing professionals, they're coming down with COVID, and they're not having their workplace compensation benefits granted, right? Because they can't prove that they got COVID at work. Right. And so to me, that seems like a very high burden to ask someone that is working with COVID patients to prove, right, that they got it at work. And so that's obviously a great financial burden for the nurse and potentially for their family. Have you heard instances of that? And how are you, are there changes in that so that, if any of our nursing staff or medical staff come down with COVID-19, that they have the appropriate financial support?
Yes, we have screeners in the healthcare system, and if the healthcare workers go to the work, they will be asked for this flu-like questions, like they have a fever, flu, and they will check the temperature, and if the temperature is high, and they will be referred to their managers and administration, and they will take a decision. They will be quarantined and they will be observed for a certain period of time, and from that we can find out whether they are infected or no. And the hospital system, they have adequate measures to follow and cover the health employees.
For the PINASA members, so far we didn't hear any issues about that. I can speak for for the facility where I work, which is University Health System. So we provided, benefits for our staff if they contacted the COVID-19. So there's just a process that they need to follow, and we constantly communicate with our staff, and our employee health employee health department is very helpful. So in terms of that scenario, thankfully we didn't get to experience that.
Good. And I know this is one of the things as well that's being discussed at the federal level, and this is a huge concern, because this would be a big financial cost for the states if you now have all these workplace compensation benefits. But look, as far as I'm concerned, you're on the front lines, you're serving, and if there should be presumption of coverage, right, where you don't have to necessarily prove you got it on the job, because that would be very, very difficult, almost impossible. And so, I know some people appreciate the flyovers, but look, as somebody that wants to make sure that we're actually honoring the service and sacrifices of our nurses and medical professionals, I think the financial support you need, if unfortunately you get, if you come down with COVID-19.
Yeah.
We are also, you all are doing such courageous work, and we're also hearing about nurses that are experiencing or having symptoms of PTSD, right, post-traumatic stress disorder. And so can you talk a little bit about the experiences of nurses and what type of support needs to exist to ensure that our nurses are as healthy as they can be to continue serving our communities?
So I can talk about San Antonio Indian Nurses Association. So our nurses are in the front line, and majority of nurses are taking care of the critical care patients. So even death of the patient, or a critical condition of the patient, or family, by seeing the suffering of the family, the nurses can, their emotional health can be affected. So our nurses have resilience, and resilience is like a learned behavior to cope up with the physiological and psychological stresses and they use their angelic effect to take care of the patient. And there are certain methods and to come up to relieve the stress, and for our nurses we use the keys like yoga, marathon race, or dance programs, or being in association, or involving them in online educations, or providing webinars, and other extracurricular activities. This way we promote their psychological well-being, so that they will be able to provide holistic care to the patients. And for the employees in the hospital, they have an employee wellness program, and the hospital will be able to support also.
Right, correct. And for the Philippine Nurses Association of San Antonio, we have numbers of ambassadors. We communicate to our members through them. We check on them, and we make sure that they're all right, and we make sure that they know that we're here to support them if they need anything in this time of crisis.
Good. We talked about it just a little bit earlier, but again, our medical professionals are expecting a second wave this fall. So can you talk a little bit about how your individual nursing units and as an association, right, you're preparing for that?
We are always expecting for the unexpected, right? So, this is a big example, and we need to be always be prepared with our PPE, that is our protective equipments, goggles, gloves, all that. And, as nurses, we should have our own PPE, that is passion, then empowerment, and compassion, that we always have. And when we provide to the patient, we are providing the TLC, tender loving care. We always have that. And in the meantime, by October or next time, we will be getting a new vaccine so that we don't have to be worried about it, then most probably this can be eradicated altogether. But we have to learn from the lesson, and we should be prepared for the worst enemy, and always be prepared.
Sure, absolutely.
Yeah, and over communicate. So to make sure that the staff and our members know what's going on, what to expect, so that they will not be in a, in a limbo that they're waiting for information. So that's why every day, I mean, how many times in a day that we have to communicate to them what's happening, what's going to happen, what's the search plan, so that they know, right? And they know what to expect, and that will alleviate their anxiety and fear.
Yeah. This is, please, Jane.
Yeah, so another important, I think one important thing you have to remember, to prevent a second wave, or if there was a second wave, how can we minimize the impact to people and not be too complacent as cities are opening up? As we open up and businesses open, following the recommendations of each of our governments, CDC, in quarantine or wearing masks in certain crowded locations, trying to be considerate of others as well. I think it's very important to prevent that. It doesn't just belong to the healthcare workers. I think it's a community effort as well. So I think organizations have learned from the shortages that we're experiencing in other places. So I think we are prepared, we have plans in place, but we still have to maintain social distancing where it needs to be, wear our masks where it needs to be. So we are still conscious of that. And like everybody would say, this is our new normal.
Yeah. We hear a lot about, from medical professionals, about the importance of having a national testing strategy, right? We need to be testing a lot more people. We need to have contact tracing in place. There's this whole public health infrastructure that needs to be in place to ensure that we are, one, able to open up the economy again, but in a safe way, right? So can you help us understand, if there was, more widespread testing, if we were testing 10 times as many people, for example, in San Antonio than we are right now, how would that change your everyday, right? What does that change? How does that change what you would do, what the medical issues or your approach if we were testing more people and we had contact tracing available?
I think testing is good, yeah, so that we can have a good data with that. But the CDC guidelines says, simple measures like hand washing, keeping the social distance, and wearing the mask, and not to touch the face and nose. These are the measures need to be followed by the healthcare professionals as well as by the public. If we follow that, we can reduce this infection in a massive way.
And I also think that the testing that's available at the moment, however specific it could be or sensitive it could be, that's a moment in time.
Sure.
If you don't practice social distancing and mask or wear a mask, that may change. You could be exposed to anybody at any point in time. So testing proves you're negative at that moment. It was not detected. The virus was not detected, but because there's not any vaccine available at this time, there's not a cure, you could easily contact it again, like days later.
Sure. Yeah.
Be tested and be positive, but it does give you the sense of calm, that somebody's negative.
Yeah.
So
also, if somebody is positive, right, and they need to be quarantined, I think that's the concern, is you've got so many asymptomatic people, and if we're still
walking around,
if we're still only testing folks that are symptomatic, and you've got asymptomatic people walking around infecting others, then that is a challenge, right? And that
It is.
What we've seen, which is a really the need to clamp down. And so, testing, it sounds like, is the key, because the more you either know somebody has it or they don't, and then you take appropriate measures there. And then go on to antibody testing, it sounds like, which, there's some benefits of that once we better understand the scale of the problem. And it's so important, because this is a district that goes from San Antonio 500 miles west all the way to El Paso. So, a lot of West Texas has had a very different experience with COVID-19 than in our larger cities. And so, when you're able to test a lot, then, and those, many of those communities are ready to get back to work, as we all are, but in those places where they just haven't seen a lot of cases, for them, it's hard for them to understand why, you had these very restrictive procedures and kind of protocol in place. And so more testing would actually allow them to return safely, knowing, with that peace of mind, that they open up.
Yeah. I agree.
We are, and you mentioned it, Dr. Neri, the importance of, and as you, as well, Dr. Barkal, masks, right? Just basic, just that by itself, and how effective that is. I think one study from Hong Kong said that, that just masks alone reduces transmission by 75%. And so, for me, for everyone watching, right, you're looking at the people on the front line of this war. Right. And so if we really want to honor their service and their sacrifice, well, let's make sure they see as few people as possible who are sick with COVID-19. And the best way to do that is to wear a mask. Right.
Yes.
Wash your hands.
Yes.
Yeah. I want to also give you a little bit of time to talk about the good work that your organizations do. Again, this is Asian Pacific American Heritage Month. So Dr. Parakal, can you talk a little bit about, some of the activities that the San Antonio Indian Nurses Association does? You've talked a little bit about what you do now, but what are some of the activities that you do during the year?
Okay, so San Antonio Indian Nurses Association formed last year, and we had our conference and gala last year in 2019, November itself. And during the conference, we were able to contribute 1,000 kits for the Havens for Hope. And so we got a special commendation and proclamation letter from that. And afterwards, during this COVID season, we were actually providing certificate to the nurses, those who are in the front line, and with the COVID patients, whenever they take care of the patients, and critical care nurses, we are providing the certificate and acknowledging their bravery for being with that patient, because they are sacrificing their own life, and as well as they are taking care of the patient. And so we call them heroes, and we provide them certificate. And not only in San Antonio, in other places also, we get, they ask for help, because they in other country also they have lockdown, and there were a number of feeding programs were going on. So here in San Antonio, we helped San Antonio Food Bank, along with joining with SEBA International and ISA, to India and other countries. We donated money and help, and those who donated money and help, we provided others for them. So we are encouraging the people to help the community at this pandemic crisis. Not only that, we are providing food to the healthcare system by collaborating with universities, Texas, Arlington, and Texas A&M. Texas at Arlington and Texas A&M actually helped us to distribute the food to the healthcare system, so that we provide their morale of the frontline nurses. So during this pandemic crisis, we were able to do more than we are able to do in other times, because our theme is service before self, and this is the right time, being a nurse, and your knowledge and your experience to be utilized to your organization and to the community. So I think we are doing fine at this time.
Wonderful. Well, thank you so much for sharing that. Golda, do you want to talk a little bit about the Philippine Nurses Association?
I will let Dr. Neri discuss discuss that because that's under her term still.
Okay.
Go ahead, Jane.
Yes. Oh, wow. So anyway, thank you. But we've done so as an organization, Philippine Nurses Association San Antonio. We've had multiple education sessions last year in 2019. That's done annually. There's a spring fall conference. We also award scholarships. We've recently we've awarded to bachelor's science in nursing and master's and doctorate level 2, and we've also recently just inducted the PNA in Texas as a subchapter of PNA San Antonio. So we've expanded our reach as well. During COVID, we've participated. We are also, by the way, actively participating in Stop the Bleed programs until we had to stop it, stop the classes. But it's a good program that talks about responding to catastrophes or disasters, right, Golda?
Yes.
With the county. Golda's actively teaching in that too. Also, during we formed the Pinasa Sewing Circle, and we've actually sewn masks for our members, personal masks, using the instrument wraps that are available. So repurposing that, and we plan to send masks to our members. We have currently 2 researchers participating in a study, a grant from that we're applying for on mental health and the impact, as you were talking about, of COVID on healthcare professionals. That's ongoing. Did I miss anything else, Golda? For
the fundraising for the Taal volcano victims.
Yeah, we've also supported the Taal volcano eruption in the Philippines. And we've also donated the food bank recently during COVID. Not forgetting the communities as well, and not just the patients in the healthcare settings. We also had a member or an executive board member who assisted those that had to file unemployment, who had to close their businesses. Like some home health agencies at that time were not able to function because hospital volume was low too. So there were those that we helped and really guide them on how to go about it. Because we have to also understand that even if we as healthcare workers were impacted emotionally, psychologically, financially, the impact financially, maybe our spouses, our families who were either furloughed or were laid off, that is now something that resonates with us. And at that time, we may be working as nurses, but there were others who may have been laid off or lost their jobs. So we need to think about them too.
Well,
yeah, we are also an active, or actually founding member of San Antonio Nursing Consortium, which was founded by Dr. Nelson Tuazon. It is a consortium of different San Antonio nursing organization, and we also represent Asian American Alliance of San Antonio.
Well, this has really been an honor. Thank you, Golda, Jane, Prasanna, not only for the work that you do every single day. Golda, you're still at work, and you took the time to do this. Thank you for what you're doing for our community. This pandemic is just highlighting just how essential you are. One of the things that's really struck me is the number of people that have had to die alone. And who's there holding their hand, right? That nurse, right? And so this has been such a difficult experience, certainly from an economic standpoint, from a public health standpoint. And when you look at the people that have really had to step up and get our community through this. It's exactly our frontline and essential workers like nurses like you all. So thank you so much, on top of the work that you're doing to contribute to our community every single day. So thank you so much. For everybody watching, thank you for joining us. Please continue to be smart and safe and healthy. Wear a mask. It's not a political statement to not wear a mask, right? You not wearing a mask, the only political statement that could be is somebody's death sentence. Okay? So let's be very clear about the respect that we owe to everyone in our communities, and certainly the respect that we owe to our essential workers like our nurses on the front lines. And we can do our part by wearing our masks and being smart about it. So again, I hope everyone stays safe and healthy. Thank you so much, everyone, for joining us. And we'll see you. Take care.
Thank you.
Thank you.
Everyone.